Welcome everyone. Thank you very much. I would like to welcome our distinguished speakers. From the vaccination section, we move to the next room. So first of all, a little bit of housekeeping. This is the slido format. So it allows you to post questions. If you connect to slido.com and you type in those numbers, 400 1945, you can pose your own questions, you can top questions that you find interesting, but also you can pose questions directly here. So that's the first thing. Do not forget to take your certificates of attendance while you're leaving. And also I would like to invite our lovely speakers from both vaccination and women in medicine section to the speakers' dinner that will be held in the city center. We'll be leaving from here, so just try to hold on to us so that you don't get lost, but the address should be in your email as well. But we're happy to take you there. We'll take the metro and we'll go there together, and we're very much looking forward to having you there and to talking there together. So first of all, I would like to ask Dr. Giovanni Spitala to present the first introductory talk, and then we will continue with the discussion.
It's just a funny way to kick us off into the topic, basically. So at some point my mom asked me what do I do for a living, how I earn my salary and pay my bills, and I was like, that's a nice question actually. So I made a map. I'm a bit into computational linguistics, and I extracted all the papers that talk about ethics indexed in PubMed. Divided by year. So this is our pre-COVID baseline, 2010-2019, and then we have 2020 and 2021. And to kick us off talking about vaccines, I thought it would have been interesting to see how the clustering of these words, of these keywords in the area of vaccines, vaccination changed over time. So what you're seeing here is basically, as I was saying, a map of keywords. And the clusters are defined from a concurrency matrix. So the more two keywords appear in the same paper, the closer the connection will be. So the clusters are formed in this way, and then the relative size of the dots represents the relative frequency of these keywords in the corpus. So in 2020, 2019, when talking about vaccines, we have this very isolated small cluster, so vaccine surveillance. And then there's this bigger cluster. Okay, done, good. We have this other bigger cluster in which vaccinations occur with Ebola, South Africa, safety, Sub-Saharan Africa, HIV, AIDS, tuberculosis, malaria, and so on. That's how we were talking about vaccines, and trust is a relevant thing. That's how we were talking about vaccinations pre-COVID. Then 2020. And as you see, many things change on this map. So we have a big cluster here, which is the emerging COVID-19 cluster. And interestingly, vaccinations, so vaccine actually becomes part of the main cluster, of the ethics cluster, together with sustainability, environment, animal models, meaning that everything that talks about ethics talks also about vaccines, as well as quality and climate change. And then we have this other new cluster emerging, which includes the COVID-19 pandemic, clinical ethics, harm reduction, resource allocation, human rights, public policy, rationing, regulation. So it's the new vaccine pandemic cluster. And in 2021, we see that this trend continues. So we have one cluster here in which we talk about vaccines, but also precision medicine, but also artificial intelligence. This is a big cluster which is connected to artificial intelligence. So in this case, it's mostly about artificial intelligence in the design and development of new vaccines. And then we have, again, the pandemic cluster here, in which we talk about autonomy, professional ethics, COVID, bioethics, COVID-19 pandemic, social justice, health equity, all topics that we touched upon today, this morning and this afternoon. And then we have this other cluster, which is somehow related and still talks about, well, contains the keyword vaccination, vaccine, in which we talk about guidelines, decision-making, clinical research and clinical practice, simulation, uncertainty, organ procurement, liver transplantation. So, I mean, that's, again, just a way to kick us in the topic and to see what we're talking about when we talk about vaccines and how the way we talk about vaccines was reshaped substantially, in a very substantial way by the COVID-19 pandemic.
Okay, fantastic. Thank you so much, Giovanni. And so now I'm glad to announce our panel today, our panel discussion on the topic of vaccination. We have, I think, 4 great speakers and me, of course, as well. And maybe if I'm giving 1 minute to every speaker, basically, to introduce themselves, just to summarize what they are doing, because I think our speakers are doing so many different things and so many amazing things that it would just be, I think I can't capture it appropriately. So I would start with Oksana.
Thank you very much, dear colleagues. My name is Oksana Kashintseva. I'm from Ukraine. I'm national consultant of United Nations Development Program in Ukraine, WHO as well, in the sphere of HIV. I'm also the member of several working groups in a parliament in the sphere of reforming public health, especially from the point of LGBT community in Ukraine.
Hello everyone. It's too loud. Hello everyone. My name is Katerina Moskalenka. I am an associate professor, PhD in law. I come from Ukraine, and my main academic affiliation is Taras Shevchenko National University of Kiev. I worked there for 10 years already. In Taras Shevchenko National University of Kiev, I teach civil law, healthcare law, and reproduction law. And currently, I'm based in Zurich. I'm a visiting scholar at Zurich University at the program Human Reproduction Reloaded. And the question of vaccination fall within the sphere of my interest because of I teach healthcare subject and because of we had a lot of ethical problems in Ukraine as well.
Hi, I'm Giovanni Spitale. I come from Zurich. Well, no, I don't come from Zurich. I come from Italy, but I live in Zurich. And I finished my PhD in Zurich this summer. And my dissertation was, broadly speaking, on public ethics in the context of COVID-19. My specific focus is, well, there's many, but like what I'm going to present tomorrow is going to be on communication and most of all on social listening. So how do we involve people, how do we involve the public, how do we take into account their opinions for how weird they can be, and they can be very weird in policy making, communication planning and related topics. I'm a philosopher by training, but I like to play with code as well.
So my name is Peter Sikora. I am from Trnava in Slovakia, from the University of St. Cyril and Methodius. I am a professor of philosophy and director of the Center for Bioethics there. And I was actually graduated from here, from Charles University in microbiology. And I spent 20 years doing a biomedical research and then turned to philosophy.
And my name is Julian at the University of Zurich. I'm a lawyer and physician by training, and my main research area is public health ethics. So I'm doing quite a wide range of topics in this area. So I'm working a lot on COVID-19 vaccine mandates, but I'm also working on the topic of proportionality, so a more theoretical topic. I'm also working a lot on issues of migrant health, also a lot on issues of digital health and public health, and also a lot on issues of LGBT health. And I'm actually, since very recently, also a member of the WHO working group on monkeypox and ethics. And yeah, so thank you very much to all speakers for presenting themselves. And now I think we can really get started with the panel discussion. And what I don't see in the hands of the audience are smartphones or laptops, so that you can join us on Slido. So it would be great if you could participate and pose questions to Slido. Of course, I think the 5 of us all also have a lot of questions to ask each other, but we want to don't want a discussion between the 5 of us. We really want to have a discussion with you. So please join us on Slido. And I mean, the most liked question has only 2 likes so far, so that's not good. So please take your smartphones and join on Slido. And I don't see a smartphone in the 2nd row. I don't see one in the 5th row. So please all join on Slido, ask questions, like questions, and then we will basically work with the questions and give you answers to the questions. So first question that I have on my screen is there an example of good practice in your country in relation to COVID-19 policy? And maybe, Peter, if you want to go first.
Well, I'm not sure it's a good question for me. Good practice.
Is there an example of good practice?
Well, is that a question for me, actually?
I think it's for everybody, so...
Okay, so... No, I cannot think of a good practice, actually. Sorry to say, but I'm trying to recall, and I cannot say a good practice. Really, I can say a lot of bad practices, but unfortunately, I'm not able to answer.
But I think then we would also be excited to hear about the bad practices, actually.
Oh, well, it's a lot. As I mentioned in my talk, the national strategy of prioritization in vaccination was wrongly set, then followed by orders or degrees of Minister of Health actually pushing the high-risk all categories later and preferring younger people for vaccination, which was again bad strategy for vaccination against COVID. Then the whole system of to get the vaccine, the access to vaccine was, based on internet registration, but it was for all the people, like 80-year-old people, 70, and all those people were unable to, or the online registration was not the best way how to deal with vaccination of old people. Then changing and very bad communication with public which actually undermined the trust of public to the whole process of vaccination. Then actually when they should close and make a quarantine, they open the society, and when they should open the society, they actually close. So mismanagement from this epidemiological point of view. Then actually not transparent communication between the Council of Scientists advising government how to deal, and so the whole communication between the government and Council of Scientists were not transparent. It was not clear who is in the council and what's the official statement of the council. So the politician used the council as a backup. Then the council said that's not true. They did send just the opposite. So it was not a transparent communication. There was no web page of the Council of Advisors, so you couldn't see not even the members of the council, but you couldn't see an official statement of the Council of Scientists. So what else? The financing of there was a lottery for the to get vaccinated. There was a complicated lottery actually, which people were not motivated to vaccinate, but actually frustrating of the whole lottery system. So again, it raised a mistrust between the public and government. I think it's enough, but I would continue and go on.
Mm-hmm. Thank you very much, Peter. And maybe someone else from the panel who has a more positive experience with pandemic management.
If I may, it seems to me that in Ukraine we have such positive experience because after such a deep propaganda against the vaccination, which was provided by Russians medias in Ukraine, our Ministry of Health could change finally the situation, and we have such body as a Council of Churches, and they also promote for vaccination. And finally, these payments for each person, for each dose of vaccines, it also was a great support and stimulates to people to be vaccinated. So it seems to me that our Ministry of Health, yes, they provide proper policy, and we could change this anti-vax propaganda in Ukraine.
Mm-hmm. Yeah. Thank you very much, Oksana. Anyone else, anything to say on this question? Giovanni, you're nodding a lot. Yeah.
One thing that really worked well in Switzerland was the immediate reallocation of research funds and the redefinition of research priorities to tackle the issue of COVID on many levels, like on the medical and on the societal level as well, which is still enduring. So we still have specific funding for being prepared for next time, and the fact that this switch was possible and so fast, I think it's a very clear marker of a good policy response, and of which we are grateful, I think, right? Mm-hmm. And another thing that was crucial in Switzerland was the fact that all the data, all the epidemiological data, all the research data were open as soon as possible, as much as possible. And all in all, the communication campaign started by the Federal Office of Public Health was quite, not entirely efficient, but quite efficient. And they tried to reach more and more segments of the population, adapting the language as well. The languages, sorry, not the language. So that it was easier to understand also for a lay public. With specific focus on vaccinations, for instance. On vaccinations for children, they did a good job in that sense. And then the way the registration for the vaccination campaign was managed, like with an online system, transparent, in which you could register and get a notification for when your appointment was to be, and so on, that was functional as well.
Thank you much, Giovanni. And maybe so there are two questions to Katerina, and maybe I'm moving to the first one of the questions. So the question is, what is the role of intellectual property in the access to vaccines? Are there any ethical concerns?
This is the question to Dr. Kashintseva.
Two, yeah, it's to Oksana. Sorry for that.
Both of us, we're familiar with this question because last year it was a reform in the sphere of intellectual property in Ukraine. It's called National Patent Reform, which changes the attitude to the patents in the sphere of public health. Ukraine generally is a country party to all necessary, it's possible to say, agreements in the sphere of intellectual property, also is a member of WTO, World Treaty Organization, and we should stipulate it all rules which are determined in this legislation. But because we are the country, before the war we were the country with the middle income, so we could use liberal attitudes in the sphere IP in accordance with the TRIPS flexibility provisions, if it's possible to call in such way. And of course, actually, when we have the Russian aggression in our territory, we apply in a Council of TRIPS agreement through our trade representatives, Mr. Taras Kachka, to use the Article 73 of TRIPS agreement, exclusion because of the dangerous, just to what was told in the presentation by our colleagues, to implement such IP waivers in Ukrainian legislation and to use these issues. So it seems to me that this lady who provided us with this brilliant presentation regarding the COVAS also mentioned this important step to ensure the access to medicines.
Yeah, Thank you very much, Oksana. And now here's the question, Katerina. And so the question is, Katerina Moskalenko was speaking about the mandatory vaccination in Ukraine, and I was wondering whether it was mandatory to everyone or only for the employees.
Yes, I mentioned in my presentation the case when the vaccination was mandatory for the certain professions that were adopted by the order of the Ministry of Healthcare. However, this last year autumn, the Cabinet of Ministers has adopted the adaptive measures, and there were 4 zones. Green one, yellow one, orange one and red one. And the green zone was the less restrictive. It was the quarantine on all the territory of Ukraine. By definition, everywhere it was green unless decided otherwise. And depending upon the danger, the Cabinet of Ministers could introduce another restrictive measures. And the most restrictive zone was the red one, and you really couldn't enter anywhere without this COVID certificate. However, I do not think that such even restrictions introduced by the red zone are not mandatory, and we cannot say that the vaccination was really mandatory because there was an alternative to bring PCR test or express test which was valid 72 hours. So the person could choose either to spend a fortune on these tests or to get vaccinated. So it was not like there was always an alternative. And in case with the mandatory vaccination for certain professions, there was no alternative for these employees just to get vaccinated, otherwise they will be suspended from their work and will not receive any salary.
Thank you very much, Katerina. And now, moving to the next question, what do you think is the strongest argument against mandatory vaccination? And I think Peter and I already had quite of a debate during one of the presentations, basically. And so maybe I'm going to start with this question. So what is, in my opinion, the strongest argument against mandatory vaccination? Because on the one hand, I'm vaccinated against COVID, but on the other hand, I'm also strictly opposed to mandatory vaccination with some small exceptions. But to the principle of mandatory vaccination, I'm quite opposed. And I think the problem with mandatory vaccination is, so there's a famous definition of what objectification basically means by Martha Nussbaum. And she basically gives 7 elements of what objectification means, and one of these elements is denial of subjectivity. So that basically means that the feelings and experiences of a person are not adequately taken into account, and that a person is treated as not having feelings or experiences, or as these experiences and feelings being irrelevant. And I feel that in a lot of the debate on mandatory vaccination, that's actually what is happening, because we are not asking about the reasons why people are unvaccinated in these debates. We are not asking how they could be convinced to be vaccinated because being vaccinated is the right choice against COVID-19. But we are not asking about this. We are basically asking people to get vaccinated without knowing the reasons for not getting vaccinated. And I think this creates a lot of problems. So for example, when we look at empirical studies, we see that particularly in traditionally disadvantaged groups, so for example in the group of Black Americans, or also in the group in the LGBT community, for example, in the United States, vaccination rates are on average lower than in non-traditionally marginalized groups. And of course, that also has to do with a certain distrust against health policy in these countries and the way health policy has been conducted against these communities in the past. And I feel if we now add mandatory vaccination, of course, this creates a big problem because these communities are less vaccinated than the majority population in the United States for reasons of distrust in health policy. And if we now are not addressing these reasons, and if we don't implement structural changes, but rather just say, well, take the vaccine and it's mandatory, that can create huge problems. And it also contributes to the exclusion of these communities from certain services, from certain professions. So for example, if you have vaccine mandates for medical professionals, of course, people who don't want to get vaccinated can't work in these professions anymore. And of course, that leads to disproportionate exclusion of communities who just, for very understandable reasons, I mean, for example, for past experiences with health policy, just don't want to get vaccinated. So I feel there are many elements in this debate about mandatory vaccination which are just not considered too much in political discourse right now, but also in the ethics debate, I'm missing somewhat of these arguments. And I feel that mandatory vaccination and vaccination mandates are really dividing society into a part which is the good one, which gets vaccinated, and the bad one, which doesn't get vaccinated. But reality, in my impression, is more complex, and reasons why people don't want to get vaccinated are more complex. And I think we should also give consideration to this before introducing a vaccine mandate. And I feel that hasn't been the case in many states. And in many states, it has just been an approach of take it or suffer the consequences. And I feel that is very problematic from an ethics perspective. And maybe now if I hand over to you, Peter, to contradict me, I think.
Yeah, okay. I think the society change. I mean, the society, like people in Western countries mostly, change in the attitude to vaccination because they are not facing infectious diseases as they encounter in the past, you know, because the medicine, I think the medicine is paying for the success, that because of successful dealing with infectious diseases in the second half of the 20th century, since 60s, you know, when the infectious diseases were cause for millions of deaths for centuries, and humans that even in first half of 20th century was a very serious disease, like the infectious diseases actually they shape the history, and like in United States the Indian population was actually way up because of infectious disease is brought by, you know, Europeans, but that memory of and the fear of infectious diseases and dying because of infectious diseases wipe out in 70s and 80s. So the generation didn't feel that this is a real serious problem and people can die and the vaccines, because it took for, like antibiotics too, it took for granted that this is not a problem. And because of a change of the attitude, and this is not the only reason, of course, it's multifactorial, but in my view, it is one factor which is not discussed enough, that the change of perceiving of infectious diseases and also the development of bioethics, which is based on individual autonomy, liberal paradigm, and bioethics was set up in this way because the danger of infectious diseases was not an issue. Other things were in the center, in the focus of bioethics, where it was created in 70s of 20th century. So the public health and infectious diseases actually were not as a one major topics in bioethics since the beginning. And the reason is that the autonomy of individual, that relationship that each individual has, this autonomy to decide whether take the medicine or not, you know, all this against paternalism in medicine, all these issues actually led to the change of behavior of patients in a way that, and at the same time opening the access to a huge amount of information on internet. So each patient is now feeling that it's at the position of physician, pick up information from the web, and he feels or she feels that it's a partner to physicians, an equivalent or equal partner to physician, even knowing better than physician how to treat him. Or all these things together, you know, created that the people, if they have some doubts, and also anti-vaccinations, bad communication about new vaccines, you know. I wrote for one journal that is the price for the success of being so successful to develop new vaccines in 1 year. You know, I compare it to the US moon space program. So when the Kennedy said that in 10 years, that by the end of the decade we are going to step on the moon, all people thought he's out of crazy, you know. Even the Americans were not able to send people in, you know, to space around the globe, and now they are proclaiming they are going to step on the moon. But focusing, you know, so that was the first example when the scientists and the financial resources are really focused on something, unbelievable results the humanity can achieve. And that actually happened with the development of vaccines. It was many specialists doubt that the vaccine against COVID will be developed in such fast track. But also it was because the legislation of approving of vaccines and drugs, you know, so they put it as an emergency or, you know, not the full recognition of the safety of the vaccine. That was used by anti-vaxxers and not properly communicated by specialists, by, of course, government, you know. So the people argue, well, and that was one of the most arguments that, you know, this is an experimental vaccine. I will be waiting. I am not against vaccination, but I will wait when the vaccine will be not experimental, will be a serious vaccine or something. But that was misunderstanding all the process and the whole categorization. You know, so all these things actually caused that the vaccination actually didn't work, and people were not as much vaccinated as it should be, and the governments then try to somehow increase the vaccination rate, and now we had that problem in that environment to get to give a mandatory without that communications. So it's not surprised, and people expecting that there will be a big resistance to mandatory vaccination is not going to be understood. And that's actually happened. Austria is a very beautiful example. You know, from medical point of view, it was quite rational, but from social psychology, political point of view, it was crazy move. Okay, so that's what I'm saying, that I think that in such an emergency situation with such kind of, because I'm not talking in general about the mandatory vaccination, but imagine that we have a COVID not with the fatality rate of 1%, but let's say 30%. And people still say, well, I'm not going to be vaccinated. So what would you do as a government? What would you do as a goal to protect the society and population?
So thank you very much, Peter. And if I may answer to this. So, of course, mandatory vaccination is always also an issue of proportionality. So under which circumstances is it proportionate to introduce mandatory vaccination? I feel that if, of course, you have a disease which is highly transmittable and has a mortality of 50%, I feel that mandatory vaccination would indeed be an appropriate measure to adopt it. On the other hand, of course, then the situation will be very much different. I mean, the context will be different in which we would need to take this decision, and I assume we wouldn't even need mandatory vaccination because the uptake of the vaccine would just be extremely high and everybody would always try to get the vaccine if really the mortality was in the range of 50%. So I think this is also one of the things that I basically want to put into the debate, that the vaccine hesitancy, I think currently when we are speaking about vaccine hesitancy, we always have the tendency to say, well, people are just opposed to vaccines and we can't do anything about it. And I think that is not an appropriate reflection of the reality, because there are many people who are opposed to COVID-19 vaccination, but who aren't opposed to other vaccines, for example, tetanus or hepatitis vaccines. So that is also already a part of the debate. And I think there are also people who are opposed to getting vaccinated against COVID-19, but many people who, for example, if we had an Ebola outbreak, would not be opposed to getting the Ebola vaccine because mortality is really in the range of 50%. So I think that, again, I think for me the strongest argument against mandatory vaccination is really that all of the vaccine mandates that we have seen in Europe aren't really built on a debate with people about the reasons why they don't want to get vaccinated. And I feel we should have this debate, and I feel the reasons why people don't want to get vaccinated are important and should really be taken more into account in this regard. And so reducing all the reasons basically to the dimension of irrational is, I think, not an appropriate move. And also, one of the things that I want to warn against is really to divide basically, so as a physician, of course, I'm strongly in favor of COVID-19 vaccination, and I would advise everybody to get COVID-19 vaccination. But as a bioethicist, I really feel that we shouldn't divide people into those who are good or who have the right opinion, basically, and think that they should get vaccinated, and those who are bad and just are misinformed or are just, for some reasons, are just misinformed or subscribing to conspiracy theories and don't want to get vaccinated for these reasons, because I feel that is not reality and that is not how reality works. And I think a lot of people have very valid reasons not to get vaccinated, and we should rather address these reasons and really try to convince people than to force them into getting vaccinated. So that is my opinion, but maybe, Peter, you want to reply to?
No.
Mm-hmm. Then I'm maybe passing to the three other panelists.
Well, my idea is that if we need mandates, something is already broken. Something didn't work in the first place. That is the thing on which I agree. In that the idea is you have some evidence, you translate it into a recommendation in order to elicit a specific behavior. And when this process doesn't work, you need to put mandates in place. I think that the argument of defining thresholds of acceptability for mandates is super difficult, super tricky, because is it 50 or 15 or 10? And what about the other contextual factors, like are we talking about a country in which we have a very solid healthcare system which can provide care for people who have other diseases at the same time or not? So I think it's like impossible to go that way and find conditions under which a mandate is acceptable. I myself think that mandates are something hard to avoid in some conditions, something that it would be better to avoid also because I agree, they tend to disgregate the social fabric, they tend to split societies. But I also think that it's very, very difficult to avoid them in specific contexts. Also because it can be that the population or the subgroups of the population that are resistant to vaccination are manipulated, and that is something that I saw myself firsthand in the data that I'm going to present tomorrow. And okay, I see the argument against having a paternalistic approach to people who do not want to process evidence as we process evidence. But then you also have a duty to beneficence, which is competing with this non-paternalistic argument. So, yeah, I mean, better to avoid them, but if need be, I think that, okay, I mean, let's focus on the question. The strongest argument against mandatory vaccination is that they tend to disgregate social fabric. It would be better to avoid them, but they might be a necessity, depending on the context. And that's my take on that.
Thank you very much, Giovanni. And then Katerina.
Yes, as a lawyer, I'm always trying to find the legal argument, and the best legal argument that I can find is the concept of personal autonomy. Of course, in a number of decisions of the European Court of Human Rights, the Strasbourg Court has recognized that mandatory vaccination is an interference into right of privacy. And also, what comes to my mind is the argument of Oviedo Convention. In Article 2 of this convention, it underlies the primacy of the human being. And it directly states that the interests and welfare of one person shall prevail over the sole interests of society or science. And this is what we are having in this issue of mandatory vaccination. And Oviedo Convention gives us the guidance that there shouldn't be unnecessary intrusion in the personal privacy and personal autonomy. So this is, in my opinion, the strongest legal argument against.
Thank you very much, Katerina. And maybe Oksana to conclude this point.
I'm not a good person to answer to this question, because I think that if the person could not take the responsibility for the welfare for the collective welfare, so it could not be responsible for its personal health as well. I think that mandatory we could avoid mandatory vaccinations, but we could be responsible before the budget to not take the money for our treatment in case of if we have infectious diseases which could be prevented by the vaccination, for example. So it seems to me that in our situation, especially in Ukraine, where we have a war, this collective welfare, our collective immunity, our collective response to infectious diseases should privilege our privacy. So I'm not a good person to answer to this question.
Thank you very much, Oksana. But nevertheless, the answer has been a very good one. So yeah, maybe moving.
Just to this question, what Giovanni mentioned, we just made empirical research about in what percent of mortality the people would decide to change their mind and get vaccinated. So it's done on the representative sample of 1,500, and it was statistically representative sample. And we increased from 30%, 50%, 75%, we didn't go to 100. And here I have the results of the 70% of mortality. And for sure, to vaccinate 34%, 70% mortality, only 34, maybe 17%. Rather, so between, because we have that scale of, because 8%, for sure not 17, almost 18%. So even in 70% of mortality, so that, you mentioned that we wouldn't need to make a mandatory vaccination if people if Ebola with 50% is around, everybody would like to. I am not so sure. I am not so sure. Majority will, but not like 90%. Yeah, we don't know. I don't want these experiments to happen, but it's that anti-vaccination feeling is really very strong and very deep. I think we need we have a big problem as a scientist, it's a challenge to social psychologists, epidemiologists, physicians, bioethicists, is a real problem.
Yeah. Thank you very much, Peter, and I actually agree on this point. I think now coming to the next question. In your opinion, are vaccination mandates problematic only for COVID-19 situations or also for pediatric vaccination policies? And maybe if I may go first on this question. So I think what Peter has mentioned is very important, that of course vaccine hesitancy is a big challenge that we have in our societies. And I think, but we can't, in my opinion, only address it through vaccination mandates, because I feel that doesn't really solve the problem at its root, and it doesn't really solve the problem in a long-lasting way, basically, in the end. And I think the key problem here is an institutional distrust of citizens in health policy, and in the way health policy is conducted, and also in the way health policy decisions are taken. And for example, what I find really exciting from the debate that we had about pandemic management in our countries was that at least Giovanni and I are quite positive, actually, about the pandemic management in Switzerland, which worked without a lot of restrictions, which worked without a lockdown, without school closings. So I feel that that what is also important is not only to work on getting vaccination rates higher, but also to work on the relationship between the citizen and the state, and also to work on trust in health policy. And I feel this is the same challenge for vaccine mandates regarding COVID-19, but also for pediatric vaccine mandates. And I feel that is really the challenge that we need to take. And I feel vaccine mandates are only continuing to erode basically public trust in health policy. And for example, if we look at the countries where vaccination rates are lowest against COVID-19 in the European Union, that is, of course, in the countries which have formerly been under communist rule. And of course, that, I think, relates a lot to the relationship between the citizen and the state, which has built in this time, and the distrust in policy, which has built in this time. And I feel that if we don't want only people to get vaccinated because they are forced to, but because they understand that it is important, I feel that we need to address this point. And I feel imposing vaccine mandates is just a step in the wrong direction there.
If I might comment on this, because I think it's relevant, we might, as you were saying, we might sort out an issue today and have a bigger one tomorrow. And I mean, I myself, it's a bit complex. So when I was 20, I think 21, I was diagnosed with bone marrow disease. So I've been immunocompromised for the vast majority of my adult life. And because of this, like living in a country in which you do not have herd immunity against measles, for instance, that was a problem for me, like potentially a big one. Still, nevertheless, I think, and I heard, and so any kind of weird stories when we started talking about mandated measles vaccines in Italy, like these schools in the woods that people organize to avoid, well, that's weird. But it was a thing. The thing is, we need to think, we need to plan for the long run, and not only for the short run. And I think that a vital strategy in this sense is citizen science. People do not trust what we do because people do not understand what we do. And if we start doing more and more citizen science, if we try to involve more and more people in the academic work, in research at every level, in a way that they can relate to, that they can understand, so that they see that we are not like freaks doing weird stuff, which is true, we are freaks doing weird stuff, but not in that way, right? Then we can actually tackle this problem of mistrust in academia, in science, and in institutions. And again, I think we need to parallelize strategies in this sense, in that we need to think on the long run, but also we need to tackle immediate emergencies. So there is no one solution for this problem, for COVID-19 vaccination mandates, for pediatric vaccination mandates. I think that we need to have a very articulated and multifaceted approach to sort these issues out, for both like immediate emergencies and for the long run.
Maybe Peter.
Absolutely agree. And what we are missing actually the long run strategy. You know, it was for scientists, for microbiologists, or people dealing with this stuff since 1990s. It was clear that we are going to face a big pandemic, and mostly they expected that it is going to be a flu pandemic, some kind of combination, a new combination, and still not prepare in a way you know, and maybe now is some change, because this is the problem with this global vaccination, you know, it's really, we need to some global system to monitor, to make a quick response, to make the whole system, you know, even to prepare to diagnosis for this kind and all this. We know one thing is very positive from the pandemic: if the resources are focused, and human resources and financial, and really people are supported to do it, we can do amazing things. You know, the vaccines which have been developed for 10, 15 years, you know, now in one new kind of vaccines, you know, not original plant, mRNA vaccines, completely new kind of vaccines for COVID. It's an amazing achievement in medicine, in science.
Thank you very much, Peter. And maybe now a question to Katerina, which we got from the audience. What is your opinion on the content of European Court of Human Rights, Verichka versus Czech Republic decision from an ethical perspective?
This is the case concerning the vaccination of children, which really falls in line with the previous question. And I really think that the question shows how the good example of proportionality was created between the mandatory vaccination of the children and their access to educational facilities, and the maintaining of the good condition of the public health. In this case, there were 6 applicants, one father of the children who got fined because his kids were not vaccinated, and 5 children that were denied the access in the educational facility, and they claimed the violation of 2 articles. Article 8, this is the right to privacy of the European Convention on Human Rights, and Article 9 of the European Convention, this is the freedom of thought, belief and religion. And the European Court of Human Rights has stated that the legislation in the Czech Republic, it really created a good proportional interference into the right of privacy of these children, because it was legal and it was really needed in democratic society. And also what I liked is how the European Court of Human Rights look at the exercisement of Article 9. This is the freedom of belief and religion. And the judges in their decision, they have written that mandatory vaccination for children is necessary to everybody, regardless their religion. And this article doesn't guarantee to behave whatever your religion or thought or belief dictates you. And as a member of society, you really need to fulfill your duty and not to put the other kids in danger. And by taking all these considerations in mind, the European Court of Human Rights denied the violation of the applicants. And I really think that it's a very good example of proportionality, of proportional interference into the right to privacy.
Thank you very much, Katerina. And now we have another question from Carla. What is your perspective on the current science communication for vaccination, the process of information flow from science to government to layman society? Anyone who wants to take this question?
I want to take this question.
Then go ahead.
It depends a lot on the context. I think that the main critique I have in this sense, again, it depends a lot on the context. In many places things have worked in many different ways, but in general one thing which was lacking from my perspective is taking into account the specific positions of people who were not willing to accept vaccinations. And yes, it's tempting to dismiss these objections as ramblings, as fanatications. Often they are ramblings and fanatications. You will see examples tomorrow. But we need to address these concerns. If these people ground their refusal to get vaccination on these reasons, we need to provide answers in line with these reasons, which doesn't mean entering into that rabbit hole all the way down. But if we keep telling the same story, these are the data show that it's effective, the data show that it's safe, and this narrative is not compelling for these segments of the population, you are never going to convince them with this data and this narrative. So that is one way in which science communication around vaccines can be improved. I don't remember what was the question. And you closed it.
Yeah, sorry for that. So it was about science communication.
Okay.
If you are regarding the process of science communication from scientists to government to
So I did
to
answer.
lay persons. Yeah, in general. Yeah, you did. Yeah. Okay, fantastic. Then I think we can move to the next question. So there is a big question already waiting basically at the top of the list for quite some time, which has most likes. So I would suggest that everybody from the panel should give a perspective on this. So the question is, were the school closings ethical? And maybe Oksana, if you want to get started.
It seems to me that yes, in that situation of the beginning of pandemic, yes. I could answer from the perspective of Ukrainian situation. We have not vaccine at the beginning of pandemic. We did not participate in ECOVAX, unfortunately. Our government several times applied to AstraZeneca and to Pfizer to obtain voluntary license to produce the necessary for Ukraine in that time amounts of the vaccines, but unfortunately these negotiations was not successful. Thus, it was for Ukraine. It was one way how to keep this progress of pandemic.
I really agree with Oksana, and also our government did a very good job to pursue the right to education of the kids, because we had online school and it was conducted on TV. It was a very successful project. I myself liked to watch these lessons. They were really super interesting. So really, I think it was ethical from all the points of view, from the right to education of the children point of view, and for the, let's say, security of all the society.
Yeah.
I think it really depends on the phase of the pandemic about which we are talking. I agree absolutely with when we talk about the first phase of the pandemic. But one of the things on which we are working now is a graphic novel. So 16-year-old me is like, well done, you're 35 and working on graphic novels, amazing. We're working on a graphic novel which is co-produced, co-developed with a citizen science approach with a group of Gen Z people, so that generation. And for me, the lockdowns, we didn't have lockdowns in Switzerland, but like, it didn't really change my life. I am half of a sociopath myself, so at home I'm mostly fine. What I missed was paragliding. That is something that was problematic. But it did not really impact my life, my social life, the fact that I couldn't leave my home. So when starting developing, because we involved these people or some members of this segment of the population in the development of the proposal already with a truly citizen science approach, they focused on this issue. They were happy to do their part, to be part of the collective effort, of the collective response pandemic effort. But the burden for them, especially for like teenagers and post-teenagers, was very high, and this is also documented in literature. Still, I think that school closings in the early phases of the pandemic, without vaccines, without other means of response, was appropriate. But still, I think it's important to remember that we might underestimate the impact that this had on that generation.
Thank you very much, Giovanni. And if I may add on this point, so of course it is a question of proportionality, and again it depends on the stage of the pandemic, and it also depends on the disease, the knowledge, availability of vaccines, etc. But what I think in pandemic management has basically around the world not really been taken into account are children's interests, and they have not been adequately taken into account in a really big number of countries. And I mean, schools aren't just there for educational purposes, and of course the loss in education is very important due to school closings, but they also have many other purposes. I mean, social purposes for social development of the person, psychological purposes, mental health problems now being very much on the rise in this generation, and actually the WHO warning that mental health problems linked to the COVID-19 pandemic are a really big challenge and a really big threat to the livelihoods and also to the lives of persons now, and particularly of children and young adults. So this, of course, then also when it comes to physical exercise, that also hasn't been really taken into account. And also yesterday a report published by the WHO that a large proportion of the world population, I think in Western countries it's in the range of 35%, so in high income countries it is 35% who don't have at least 150 minutes of physical exercise per week. And of course, due to the pandemic management that has also increased quite heavily in many families, and of course these practices of not getting enough physical exercise haven't been removed after the pandemic. And another aspect, of course, which is very little considered in the debate, but very important, is of course domestic abuse and violence. And I mean, this has gone drastically up during the pandemic, and it has been ignored very much by policymakers because, of course, it concerns very vulnerable parts of the populations, and it concerns women a lot, and it concerns children a lot. And I mean, these groups don't have a big voice in policy. And I feel that is also a topic which would have needed to be addressed much more in the context of the pandemic response. And which role do schools play in the prevention of domestic abuse and violence? Of course, if children come to school and, for example, expose bruises, then of course there will be certain measures normally introduced to really investigate where these bruises come from or where the violations come from. But when schools are closed, and this is also backed by empirical evidence, then of course it is much more difficult to detect these cases of domestic violence and abuse. And of course that presents huge problems. And I mean, it really, I think the lockdowns in particular and the school closings really put children's livelihoods and also lives at risk. And I feel that was definitely not ethical to close down schools during the pandemic. And I would even say during the first phase of the pandemic, it was not ethical. But from what I know, in Switzerland, schools haven't been closed down exactly for all of these considerations. So yeah, but that would be my perspective on the question. And now maybe Peter.
Maybe again, I don't agree with you, but I agree with you. You were listing the cost because of closing schools, but we also need to talk about the benefits of closing schools and what would happen if we didn't close the schools. So I agree with was said that obviously in the first stage, with no vaccination of high-risk population, the children in schools would accelerate the spreading of COVID. So that would be like putting oil into the fire in a case when we want to, minimize or something. So, okay, so now we have a cause and benefit. So spreading and more deaths or physical training of children or something. We have to, make some, I agree with you, there are serious causes. We have to define them, take seriously and deal with them now. But we couldn't avoid them in principle because of the epidemic issues. In some countries, and Slovakia is that country, is a question, but that's the question of epidemic management pandemics, whether some schools should have been closed for such a long time and not the shorter time because the epidemic situation was changing. What was true for the beginning was not true a year after, and all these things. Okay, so, but I really believe that open schools in such situation, not because of the damage or deaths of children, but because of spreading through the population in school. This is the ideal for these kind of infections. That would be the ideal for spreading, like putting, the petrol to the house in flames.
Mm-hmm. Thank you very much, Peter. And just one point that I wanted to add, because it also connects to the other main theme, of course, of of our event, which is Women in Medicine and Gender Equality in Medicine. And I feel that when we talk about these issues about health policy, we are often only talking about the decisions which had been taken. But I think we should also talk about the institutional frameworks and the structural frameworks which stand behind these decisions. And I feel that when we look at the pandemic management, and I think that relates to the question of school closings, when we look at the pandemic management, I think the perspectives of the people, so I think it would have been much more important to take into account the perspectives of vulnerable groups. And I mean, pandemic management, the way health policy works in our European societies, let's be honest about it, is for white, heterosexual, cis men, basically. So it is not made for women, it is not made for LGBT people, it is not made for children, it is not made for ethnic minorities. And I think all of these aspects also play in here. And I feel that also leads to the situation where we're just losing important issues out of sight. And I feel that, for example, this topic of domestic abuse and violence is just an extremely important one in pandemic management, but it has not been prominent, I think, in no Western European country, and it has not been a priority for governments to address this during lockdown, even though, I mean, the victims of domestic abuse and violence are just going through enormous violation in the end and enormous suffering. And I think that would be really necessary to have a structural change in health policy and the way health policy is conducted, and also to take into account the perspectives of those who aren't really considered in health policy right now. And for example, and I think that relates to the women in medicine topic very well, that really women need to have a bigger say in medicine, but also in health policy. And I feel that has not been the case in the COVID-19 response. So maybe if someone wants to reply.
I don't think it's about women, it's about recognizing that you cannot talk to and only to your statistical Italian or Swiss or German citizen. You need to talk, and you want to reach like all the segments of your society, because otherwise you have these niches of low vaccination rates because we're talking about vaccinations, or in general of mistrust, but that is something that we need to accept. I mean, in general, you could apply the same line of reasoning to mistrust in science, to belief in fake news or whatever the like. If you keep crafting messages for and only for your statistical citizen, that's a problem you're always going to have, no matter the field.
Thank you very much, Giovanni. And maybe since we're right now moving towards the women in medicine section, we have a question from Barbara, and who's asked, is there a relationship between the position of women in a given society and vaccination compliance, avoidance, or general vaccination policies? And I mean, it is my favorite question when I saw it coming up basically on the screen, because it really connects the two themes that we have, which at first sight have very little in common. I mean, on the one hand, gender and medicine, on the other hand, vaccination. But I think we can find some common dimensions of these questions. And as I said, I think women in medicine, or gender equality in medicine, is also very relevant to vaccination policy in the end, through the institutional dimensions of health policy. But I don't want to speak too much. I want to give the question to someone else to answer. And maybe Oksana, if you want.
For me, it's difficult to answer to this question because I never feel discrimination or any special attitudes for me as a lady in a science or at the university or any other institutions in Ukraine. So I never think about these problems through this. Despite I'm fighting for the rights of LGBT community, but as a woman, I never feel such problem in Ukraine. So it's difficult to answer for me. What is the perspective of this women attitude to this issue?
So maybe the best idea would be to put it to the panel for tomorrow.
Yes.
So I'm keeping it in mind, the question, and then I'm going to ask the question back to Barbara. So yeah, that will be exciting. So now we have a question by Maria, who asks, Peter, I have a question to Professor Sikora. What is the organization of bioethical committees in Slovakia? What is their role in defining the COVID-19 vaccination policy?
Yeah, what is the organization of bioethics committee? What is the role in defining the COVID vaccination? Well, the ethics committee was supportive of the vaccination from the very beginning, in a way that if people are complaining some hesitancy, well, they say that even because it's Roman Catholics in Slovakia, majority are, that even the Vatican was in support of vaccination. So it's not, because there was some in religious circles that some refusing vaccination because of a kind of fake news that those vaccines use some dead human embryos or something like that, so the Catholics shouldn't take the vaccines because of that. So it was a clear message that also the ethics committee, the National Ethics Committee, the Ministry of Health, prepare a difficult problem, some guidelines in case of triage for hospitals, So based on some good practice so prepare after some debate, because the physicians, the anesthesiologists had a different opinion, So but there was a document. On the other hand, I was a member in the time ethics committee, and I tried to, because as I said in my talk, the prioritization in vaccination at the beginning, in the first stage of vaccination, was mismanaged, and also conceptually, that the younger groups of people, less risky younger groups like teachers, receive a priority to older people, and also the whole system of registration for vaccinations, basically on online registration, was a big disadvantage for all the age groups. And I thought that it would be good to actually say something openly that this is not a good ethical strategy. And some members of ethics committee supported me, but finally the ethics committee as a whole was not able to prepare that document. Then I decided to resign from the ethics committee, and at the same time, actually, when I was resigning, the Minister of Health actually brought unregistered Sputnik to the country, which I thought that's enough for me. But ethics committee didn't make any statement to it. It remained silent, and I think that's not good, because that as I wrote to the ministry in my resignation letter to the Ministry of Health, that's a very dangerous precedence that unregistered vaccine are going to be used in public for any drugs, So that's it.
Thank you very much, Peter. And now we have a question which I find a very nice one. So it basically says, why do you think that vaccination is also an ethical issue? And what do you see ethical aspects in vaccination? And I feel it is a great question, because in the end it means, what are we doing here? So why are we here? Why are we debating? And so I would like to put this question to all panelists, basically. What ethical aspects they see in vaccination, and maybe if you want to start, Peter, or Oksana on?
It seems to me that I am already answered to this question by my previous talks regarding the counter-arguments, yes, of mandatory vaccination. So yes, it seems to me that collective welfare is a very, very important issue in our reality, not only of the reality of pandemic, but also the reality that we have such unimaginable previously skills and knowledges from the science. So we could prevent ourselves as human beings against such unexpected challenges for us. So it seems to me that collective welfare is the most important ethical issue, and vaccination is the most strong instrument in this aspect.
For me, the ethical issue is how much can this collective welfare dictate the intrusion into the privacy. In my speech, I was touching two topics, this mandatory vaccination and suspension from work. Is it okay if somebody loses the only source of income just because of collective welfare, because such person most probably will not have means to live? And also I touched another ethical issue is showing the confidential information on the COVID certificate when trying to enter in the public facilities. And for me it's super ethical because I didn't like it myself, showing the date of birth, for example, or picture to those who were behind me in the queue. And these are only the example of how this collective welfare interferes into private autonomy. And of course we can find much more ethical examples like this.
Yeah, I agree. Basically, we are talking about and trying to frame this within a principlistic framework, as we are trying to do. There is this tension, but I'd like to specify that yes, we are talking about beneficence, individual beneficence, collective beneficence altogether, and we need to unpack this, and then of autonomy. But also we need to unpack autonomy because there are different models of autonomy that coexist. I was having such a conversation with a colleague from Indonesia, for instance, and their notion of autonomy is much, much different from our notion of autonomy. It relates a lot with, sorry for the pun, not intentional, but with relational autonomy. Show your family, I was saying, in your medical choices. For them, yes. For us, not so much. In Italy, especially in southern Italy, yes, it's a thing as well. So that is absolutely an ethical tension that needs to be addressed. And I think that is the core of ethical issues revolving around vaccines. Autonomy, different models of autonomy versus beneficence to individuals, to communities. And yeah, it is an ethical issue. Mm-hmm. Yeah. Well, it's many actually in one.
Mm-hmm. Yeah. So I also have many ethical issues in one. And of course, I think that what we are doing, bioethicists, in the area of vaccination is really important because, of course, vaccination, at least for the vaccines which are recommended by the WHO, is a good thing. And physicians should, of course, counsel their patients to do vaccination. But then there are so many ethical issues which arise in this context, which physicians need to take into account and which also policymakers need to take into account, because the mere fact that something is a good thing doesn't mean that it will be applied in a good way, and it doesn't mean that it will be implemented. And I think these are very different dimensions. I mean, I think we all agree that vaccination is a good thing. But then, of course, comes in the question, how can the physicians basically bring it to the patients? How can they overcome many of these issues which will arise in the context of vaccination, like, for example, vaccination of children? And of course, we had a great presentation on this by Maria Del Rosso Franch. And of course, this is a big topic. I mean, how can we counsel parents? How can we advise parents on the vaccination of children? How can we leave the choice as much as possible to children? And how can we act in a non-directive way as physicians when we are basically advocating? I mean, it is in the end, physicians should advocate for vaccination, but still, how can we remain non-directive when we are advocating for vaccination? And of course, then there's the question of mandatory vaccination, which needs to be addressed by ethicists. And then there are many other issues arising. So, of course, vaccination in situations when not sufficient evidence is available. So, in cases of off-label use of vaccines, for example, as has been, for example, the case with the monkeypox vaccine early on in the monkeypox outbreak 2022, when the vaccine has only been approved for use against smallpox in the European Union, but not for use against monkeypox, the Bavarian Nordic vaccine. So these are all ethical topics coming up, and I feel that the role of bioethicists, but also the role of physicians who are trained in bioethics, is really to learn how vaccination can be well implemented, respecting ethical standards, and also implemented in a way which is accepted by the general public and by patients. And I feel that is the role really which ethicists can contribute here. And I also very much hope that all the participants in basically our event took something away in this regard and took something away that they can use for the medical practice and for their practice as physicians, because I feel knowing the ethics and knowing how to approach a topic from an ethical perspective is very important in a physician everyday life to deliver good healthcare and also to deliver acceptable healthcare for patients.
Yeah, I'm thinking about the answer, and it's true that the ethics of the people dealing with the management of pandemics, including epidemiologists and physicians, they forgot about ethics. You know, there is an article in Bioethics about pandemic ethical Waterloo. Ethics was in fact ignored, at least at the beginning of the pandemics. It was taken as a just epidemiological or technical problem. Nobody actually cared about the ethical issues. They came later. So one thing is why that happened, and probably, well, it's difficult to answer why people didn't want to complicate their life. The pandemic was a big problem itself. They didn't want another problem because, you know, some people said that bioethicists are complicating things for medicines, for progress in medicine, you know, all these ethical assessments and experiments, you know, so it's a big complication and we don't need that. But as you can see, it's so many ethical dilemmas connected with pandemics. You know, once you have an ethical dilemma, once you have that it's not clear what the right answer is. It's not clear that 100% of people agree that this is the right things, and you have starting to other alternatives are maybe better, but better from what point? You know, better. You need some value system. Is saving lives better than saving state or economy running? That's the ethical question. That's not the technical question. That's at first ethical questions, what kind of values you are going to prefer. So that's the very ethical issue at the heart of pandemic management. And all these issues which have been mentioned, all are ethical, legal, and important questions touching the lives of people, the perceptions of people of the situation. So I think it's complication. Ethicists can complicate things which are perceived without ethics more simple, you know. But simple doesn't mean better, I would say. Simple doesn't mean better. The world is complicated. If you want a simple solutions, read the conspirations on the web. They know everything and simple explanation of everything, but the world is much more complicated. beyond.
So thank you very much. And I think that is a great remark to basically conclude our panel discussion now. And so I want to thank all panelists very much, and it has been a real pleasure to discuss with you. But I also want to thank the audience, basically, for discussing with us, for providing us the questions, which have all been really exciting, and I feel we could continue to discuss on all of this, basically, until tomorrow, until the next panel discussion. Yeah, that's true. And yeah, so it was a real pleasure to be here, and I think I speak for all panelists when I say this. And so thank you very much, and I hope you take away the maximum from the Prague School of Bioethics 2022, because of course this event has been designed for medical students, but also for physicians, and to learn what is important on an ethics perspective for the job, because being a physician is not only about knowing all the medical stuff, but also about knowing how to interact with patients, and also about knowing how to navigate complicated situations. And I feel that is something that we really want to bring closer to you and really want to communicate to you. And I very much hope that you take away as much as possible from this event. And I think with this, I would conclude the panel discussion. And again, I want to thank all panelists and the audience very much. And yeah.